Hi everyone, my name is Raihanah. I work for Solina Center for International Development and Research. I'm going to be presenting the lessons from the Northern Nigeria State Immunization Strengthening Project. As a brief background, this project is currently implemented in 6 Northern Nigerian states, and it's aimed at solving the problem of low immunization coverage in these 6 northern states. The solution is made possible by the Gates Foundation, the Aliko Dangote Foundation, and the state governments, where they have a collaboration through an MOU to set up innovative funding systems and also strengthen the RI system across the PHC building blocks. SCIDaR specifically delivers technical assistance to the 6 agencies to achieve the objective of improving coverage and capacity transfer. Specifically, we do this using a data-driven problem-solving approach and also providing day-to-day management support to the agency. Now, moving on to what we do to uncover assumptions. Why does it matter? Firstly, it matters because we need to be able to test the validity of our assumptions and modify as appropriate. For example, in the initial phase, our assumption that fixing supply chains would significantly improve coverage was faulty. Over time, we found that demand was the real lever that was going to lead to the most effective change in immunization coverage, and it should have started way earlier. Our second reason for needing to uncover assumptions is that we need to appropriately contextualize interventions for greater impact. And you find that sometimes you follow the guidelines, the international acclaimed guidelines, but doesn't really fit your context to a T. For instance, in support supervision, we found that using a checklist alone was not effective. We needed to contextualize it to include more tools that will help build capacity and strengthen mentoring. Another reason is that we found that it helps to maximize return on investment, so you can always reprioritize funds appropriately. For instance, we have had to rechannel funds from mainstream social mobilization activities such as jingles to more targeted community engagement strategies involving community influencers. Another reason is that it helps to facilitate multi-stakeholder engagement for greater ownership. If you know that you have to uncover assumptions, then you will definitely need to engage, and that will help strengthen ownership. And slide number 5 is that it helps to contribute to the existing knowledge base. And as we know that resources are very important, it's good to learn from other programs and across countries even, and the work that we've done on NNRISP has been used to inform strategy nationwide and also in other African countries. Now, what makes this difficult? Obviously, there's so many challenges with implementation, but firstly, something that affects uncovering assumptions a lot is the institution you're working with. We found that at the beginning there were no structures in place with the primary healthcare boards to serve as platforms for problem solving, feedback, or iteration, and we needed to set up those platforms to enable exchange of ideas across board. There are also issues with resource limitations where sometimes you have to make huge transitions, like the example I made earlier with demand generation. And often this will require more advocacy for funds and might stall your process. There's also an issue with political will, where especially when you're working with governments, making changes to plans and policies is really difficult and really requires a lot of time and doggedness as well. Another big problem, big challenge is the lack of robust data systems to provide required information. And you find that in Nigeria and immunization specifically, there are a lot of issues with the admin data generated on DHIS2. And also surveys don't really dig down to the granular level that will help you effect change at that level. And so that is typically a challenge. Another problem obviously is the inflexible donor requirements, and there's so many agencies that have certain would I say, protocols or certain way of working that doesn't really allow TOCs to change. Most times it's locked in from the beginning and isn't evaluated till the midterm or the end of program, and that typically doesn't favor that agile iteration that is required. Now, moving on to the meat of the matter, where we'll be discussing how we effectively uncovered assumptions in our program. I'll be sharing some examples from our vaccine supply chain work stream. The initial thing we did was to conduct targeted and deep diagnostic assessments. What was special about this was that it was deeper rather than wider. So we tried to identify what the key hypothesis on supply chain was. And we did this by reviewing existing documents and having interviews with key stakeholders at every point in the supply chain. Now, the information from that exercise was used to drill down to the last mile and conduct a deep diagnostics that helped to understand the current status of things at every facility that we were interested in. Now, using the input from the diagnostics, or the output rather, we developed a theory of change. Now, the theory of change was developed collaboratively with everyone. So there was input from government at all levels, the donors, the partners, as well as people from the private sector contributed. And putting all of that together, it informed the solutions that we implemented to help solve the problem of frequent vaccine stockouts at the last mile. Specifically, those solutions were to provide cold chain equipment to all of the wards and revamp the vaccine supply chain or delivery system. Now, it wasn't enough to, of course, institute an intervention. We needed a robust framework. Now, what we did was to leverage on the new architecture of the deliveries to also obtain data on what's happening at the facility level. Now, this data is submitted to the State Logistic Working Group, and they conduct deep dives using this data and further troubleshoot, identify root causes, and optimize stock as the case may be. However, we also know that data can be softer, or there's qualitative aspects of data that you may not get from such stock performance dashboards. So what we do is try to continually engage the users of the system at every point or every point of contact. And this helps to reveal a key, would I say, assumption that wasn't entirely true in the design of the vaccine delivery system. We initially thought that health facilities without cold chain equipment would receive their vaccines directly from those that were equipped. However, we changed it over time to have them pick up from the nearby facility instead, because that was more natural. And of course, a recurring theme, which we found to be very beneficial, is the regular engagement with the implementers to share lessons between themselves. So what we do is act as convener of biannual peer learning forums, sometimes meetings, sometimes workshops, sometimes tours, with focus states to discuss relevant issues. And this has been a platform that has served vaccine supply chain as well, where we use it to tailor what the vaccine delivery model, either as in-sourced, done by the state themselves, or outsourced, done by vendors, as the two different models. And this has helped to set the stage for the current models that are obtainable in our states now, and also being adopted for other states as well. Now, finally, over the last few years of doing this and continually iterating and uncovering assumptions, we have some lessons that we'd like to share. The first is to always be willing and open to having your assumptions getting questioned, or just keeping your theory of change open to modification more frequently than we currently have, and that open-mindedness really helps to drive change. Second is creating an enabling platform, which is what we do internally in SCIDaR. We have weekly sessions where everyone in the team, from the program director to the intern, convene and just have that diverse mix of opinions and voices, and that will help to solve problems at that level ground. The third lesson that I think is very valuable is making the best use of the data that is available. You want to milk everything that you can from data such that you're able to analyze to the most granular level that there is. Fourth is imbibing a culture of co-creation and iteration with the donor. In Solina, we meet with the donors every month consistently to discuss issues and collaboratively brainstorm on current issues and try to chart a way forward, and sometimes obviously also involve the government actors. And lastly, a key ingredient to also pushing the work forward is having access to high level officials. And this helps you to sustain that political buy-in, which you will obviously need as you continually uncover assumptions and improve your processes. Thank you very much. Over.